Living Well During a Pandemic, presented by Michelle Williams, ND, and Independent Living Resources. Disclaimer: all information in this video and the course is for educational information only and does not constitute for medical advice. Anyone seeking medical advice should speak with their medical providers. All recommendations included in the course are basic supportive measures and are not meant to diagnose or treat COVID-19. Please speak with your medical provider prior to initiation of any supplementation or exercise regimen to ensure it is safe for you. Treatments for COVID-19 that are discussed here are for information only. Anyone seeking treatment should speak to their medical providers. Presented by myself, Dr. Michelle Williams, and Independent Living Resources. I'm a licensed naturopathic physician in Oregon and Washington and hold a doctorate in naturopathic medicine from the National University of Natural Medicine in Portland, Oregon, and a Bachelor of Science in Interdisciplinary Laboratory Sciences from the Evergreen State College in Olympia, Washington. Public health specialist and disability advocate for Independent Living Resources, a member of the Oregon Association of Naturopathic Physicians and the American Association of Naturopathic Physicians, an active member of the Clackamas County Public Health Equity Committee, Washington County Access to Care Committee, and the Community Partners Council working with OHSU USED. Beginning February 2023, I'll also serve as a member of the Washington County Public Health Advisory Board. Independent Living Resources is a nonprofit organization serving individuals with disabilities in the Portland Metro and Tri-County areas. Living Well During a Pandemic, a 6-week course. Are you confused about the COVID-19 pandemic and all the information coming at you from different angles, wondering what precautions you should take seriously and which vaccine is safe and effective for you? Finding it difficult to communicate with others in your life who have a differing opinion on the pandemic and the recommendations? Or looking for ways to help boost your immunity and manage stress? If you've answered yes to any one of these points, this is a free on-demand course aimed at helping you answer these questions and gain insight and tools for living well during and after the COVID-19 pandemic. Living Well During the Pandemic course design. This course is divided into 6 weekly video segments discussing different aspects of the pandemic, which will be available by Monday on YouTube to view on demand. There will be a Zoom drop-in session for you to ask myself any questions you have based on the content you have viewed. The link to the drop-in will be posted below in the video description. The drop-in sessions are Monday, November 14th, 2022 at 11 a.m., Tuesday, November 29th, 2022 at 2 p.m., Monday, December 12th, 2022 at 11 a.m., and Tuesday, December 20th, 2022 at 2 p.m. Living Well During the Pandemic Weekly Course Description. Week 1. What do we know about SARS-CoV-2 pandemic and how has it changed and affected our lives? Week 2. Measures for protecting yourself and others who are at risk for serious COVID infection and other viruses this fall and winter. Long COVID, what is it and how do we live with it? Week 3. Vaccinations. What vaccinations are available? Who should be vaccinated and with which one? And what are the concerns and vaccine efficacy? Week 4. How to communicate effectively with individuals who may have differing opinions about the pandemic and protective measures. Week 5. Increasing immune function part 1. Nutritional guidance and supplementation. And week 6. Increasing immune function part 2. Reducing stress and wrapping up. So what is COVID-19? COVID-19 is an infectious disease that is caused by the virus SARS-CoV-2. SARS-CoV-2 is a member of the coronavirus family that are known for causing respiratory infections. SARS-CoV-2 causes a severe acute respiratory syndrome that is highly transmissible and is the cause of more than 6 million deaths worldwide. The virus is equipped with a special spike protein that is situated on the outside surface of the virus. It is through this spike protein that the virus can attach to the human cells and enter the cell and cause disease. The spike protein most commonly enters the cells in the respiratory system, causing the symptoms of cough, sneezing, sore throat, difficulty breathing, etc. Unique to SARS-CoV-2 is that these spike proteins can also cause injury to other cells in our body, such as our heart and other vital organs, making it more destructive than other SARS viruses. SARS-CoV-2 is the only coronavirus that can cause asymptomatic infections, which may be one of the reasons the virus has wreaked so much havoc on our global health. At this point in the pandemic, we have seen the SARS-CoV-2 virus adapt to our treatment and vaccines by mutating into more virulent or infectious variants. Currently in the state of Oregon, the most prevalent variant as of November 5th, 2022 is Omicron BA.5. Omicron BA.5 is more transmissible than the previous Omicron variants because that spike, Omicron BA.5 is more transmissible than the previous Omicron variants that caused a spike in infections in January 2021. However, we are finding that the illnesses are less severe with a reduction in hospitalizations nationwide. What is the triple pandemic? Well, as we move into the late fall and winter months, immunologists are warning of what they call the triple pandemic. The triple pandemic is the combination of flu season caused by the influenza virus, RSV caused by the respiratory syncytial virus, and COVID-19 caused by SARS-CoV-2 virus. Influenza affects everyone and is more concerning for those who are elderly or immune compromised. RSV mainly affects infants, but can be problematic for those 65 and older and immune compromised. Due to the winter being cold and individuals being forced to go inside, it is expected for numbers to soar and affect our hospital systems. Currently, OHSU and other Oregon hospitals are already seeing an increase in RSV and influenza hospitalizations. Protective measures. Washing your hands, wearing masks when indoors or in crowded areas, maintaining social distancing, and attending indoor events where there is adequate ventilation. Staying at home when you're sick. To test for COVID-19. If positive, you should quarantine at home for 10 days from the onset of your symptoms or from a positive COVID test. Test for asymptomatic COVID if exposure to someone who tests positive for COVID is confirmed. If positive, quarantine at home for a minimum of 5 days or 10 days after onset of symptoms. Get recommended vaccines and boosters if eligible. Eat healthy, exercise, and get adequate sleep. Have questions? Join us for a Zoom drop-in session to ask questions or talk to others in the community. I will be there available to answer questions or guide discussion. The Zoom meetings again for 2022 are Monday, November 14th and December 12th at 10 a.m. and Tuesdays, November 29th and December 20th at 2 p.m. Click the link in the description to attend. All meetings are open to ILR consumers and are a safe space for conversation and questions. Anyone acting aggressively or rude to another attendee will be immediately removed by me, the administrator of the meeting. References: the CDC COVID data tracker, coronavirus spike protein activated natural immune response, damaged heart muscle cells by the American Heart Association, SARS, MERS, and COVID-19, an overview and comparison of clinical laboratory and radiologic features by the Journal of Family Medicine and Primary Care, Volume 11, Number 1, WHO, Coronavirus Disease, COVID-19, the World Health Organization 2022, and Molecular Mechanisms of Interaction between SARS-CoV-2 and Host Cells and Interventional Therapy, Signal Transduction and Targeted Therapy, Volume 6, Number 1. Thanks for joining me, and I look forward to seeing you in the Zoom sessions and for our next video.